Hello, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about sympathetic autonomic nervous system. Here is the scheme of sympathetic system. Let's start with the centers. Center of sympathetic system is located in your spinal cord in lateral horns of gray matter. And these lateral horns present only in segments from C8 until lumbar second. It means that in these segments from C8 till lumbar second, you have a lateral horn, cornu laterale, that consists nucleus intermedia lateralis, that include sympathetic neurons, and this is the center of your sympathetic system. These preganglionic fibers of these neurons exit your spinal cord within anterior roots, radix anterior, and then leaves them within rami communicantes albi, white communicant branches, and enters sympathetic trunk. And then there will be transmission, and gray communicant fibers come back to your spinal nerves, and these postganglionic fibers travel within almost all branches of your spinal nerves. Upper 7 segments of spinal cord have no this nucleus intermedia lateralis, so in these segments will be no rami communicantes albi. There will be only rami communicantes grisi that come back to this spinal nerves from sympathetic trunk. And below second lumbar, there also will be no rami communicantes albi, only grisi. So we reach the most important thing in this topic. It's your sympathetic trunk, truncus sympathicus. Sympathetic trunk, as you can see, it's a long chain. It's paired structure, have left and right, that they located near your columna vertebralis, that consist from ganglia that connected with connective branches, rami interganglionaris, interganglionic fibers. Sympathetic trunk consists about 21, 25 ganglia. It will depend how many will be in sacral and lumbar parts. You have only 3 cervical. They will have name ganglia cervicalia, trunca sympathice, upper, medium, and lower. You will have 12 thoracic ganglia thoracica, trunca sympathice, 5 or 4 lumbar ganglia lumbalis, trunca sympathice, and 5 or 4 ganglia sacralis, trunca sympathice. So here is cervical, as you can see. This ganglion cervicalis superior, ganglion cervicalis medius, and ganglion cervicalis inferior. Then thoracic. Thoracic ganglia, as you can see, they located like upper 6. They are situated on the level of neck of rib, or even on the heads, but then they decline medially and lower 7. This ganglia, it's laying on your body of vertebras, bodies of thoracic vertebra. And the lumbar, this ganglia trunca sympathice, it's laying on bodies of lumbar vertebrae. And sacral part, here you can see sacral parts, they are declined medially, and even in the end, in some cases, as you can see, they can unite. They enclosure, and they unite in one lower unpaired ganglion. So this right and left truncus sympathicus ends in unpaired ganglion sacralis impar. Cervical part of your sympathetic trunk, again, it consists of 3 ganglions. It's ganglion cervicalis superior, it's the largest one, it's about 3 centimeters. Ganglion cervicalis medius and inferior, but pay attention, ganglion cervicalis inferior in most cases unite with first thoracic. Here you can see they unite and create one ganglion. It have name ganglion cervicothoracicum or ganglion stellatum. So let's start with superior cervical. Superior cervical, ganglion cervicalis superior, it's situated on deep muscles, on this longus colli muscles and scalenus medius, in front of transversus process, so first, second, third cervical vertebrae. This ganglion consists of bodies of postganglionic neurons. What postganglionic fibers does it give? So first of all, it's rami communicans gris. It's gray communicant branches that enters all spinal nerves of cervical first, second, third, and fourth. Then two nearby vessels. So it gives nervus caroticus internus that lean on arteria carotis interna and create their plexus. Then it's nervus caroticus externus, as you can see here. It's laying on arteria carotis externa, create plexus, and travel with all branches of arteria carotis externa. I will not repeat them. And supply all these arteries, all these vessels. Then also, as you can see, Netta didn't draw it. There will be like branch to vena jugularis interna, nervus jugularis also will create plexus jugularis and supply all tributaries of your internal jugular vein. Nervus laryngopharyngeus, and there will be plexus that will supply your larynx and pharynx, and the superior cervical cardiac nerve, nervus cardiacus cervicalis superior, sympathetic nerve to your heart. But pay attention, we must describe closely internal carotic plexus. This nervus caroticus internus create plexus, and this is plexus caroticus internus enters your cranial cavity. And first of all, some branches create on arteria ophthalmica, create plexus ophthalmicus, enters your orbital cavity, enters your ganglion ciliare, but it's parasympathetic, so these fibers just walk through, and then walk to your inside your eye within this ciliaris brevis nerves and reach your musculus dilatator pupilla and causes like mydriasis. You know, mydriasis, it's like enlargement of your pupilla, and this center, it's cervical, 8 and thoracic first segments of spinal cord, and then after it this plexus is travel on arteria cerebri anterior and media, and will supply this plexus will supply all these small arteries, small branches of your brain. And second interesting thing here, inside temporal bone, there will be also some fibers that cause nervus petrosus profundus, deep petrosal nerve. When we speak about a nervus petrosus major, it go through foramen lacerum, and when it gets on your cranial base, there it unite with deep. So here is this deep petrosal nerve. It's sympathetic nerve, consists sympathetic fibers. Nervus petrosus major consists sensory and parasympathetic. They unite and create this nervus canalis pterygoideus. You remember Vidian nerve that go through canalis pterygoideus and reach ganglion pterygopalatinum. So this parasympathetic ganglion and these sympathetic fibers just walk through and also go within all these branches of ganglion pterygopalatinum and supply mucosa of nasal cavity and oral cavities. Ganglion cervicalis medius. Middle ganglion, located like on the level of 5th, 6th cervical vertebrae, also on these deep muscles. Also get preganglionic fibers from lower ganglion, and gives united also with upper with rami interganglionaris, and gives few postganglionic fibers. Postganglionic fibers also will be rami communicantes grisi that will enter spinal nerves and branches of your brachial plexus. Also, it will be nervi vertebralis that enters, that lean on arteria vertebralis and make this plexus vertebralis, and nervi carotici communis that lean on arteria carotis communis and create plexus caroticus communis, and nervus cardiacus cervicalis medius, middle cervical cardiac nerve that go to your heart also, and lower or in most cases ganglion stellatum, ganglion cervicothoracicum inferior unite with first thoracic and create this ganglion cervicothoracicum that is located, it is situated behind, as you can see, your arteria subclavia, and gives these postganglionic fibers also. It's ramicommunicantes grisae to your brachial plexus. It gives nervus subclavius, it's laying on arteria subclavia, create plexus subclavius, and will go with all these branches and supply all arteries of your upper limb. And also inferior cervical cardiac nerve, there is nervus cardiacus cervicalis inferior to your heart, and this connective branch between like middle and inferior cervical ganglions, it's this one. As you can see, it's like a loop. It go under your arteria subclavia, and it calls ansa subclavia. It have a eponymical name, ansa vieseni or ansa subclavia. It's rami interganglionaris that connect your ganglion stellatum with ganglion cervicalis medius. Thoracic ganglia, again located on your vertebras, your thoracic vertebras, and they get ramicommunicantes albi, it's preganglionic fibers. These ganglia thoracicae, truncosympathic, gives ramicommunicantes grisae also to your intercostal, to all your intercostal nerves. Second, they give nervi cardiaci thoracicae. It gives a lot of cardiac thoracic nerves that goes to your heart, and there will be thoracic splanchnic nerves that will supply your internal organs, and rami aorticae that will, as you can see, laying on aorta and create plexus aorticus thoracicus, plexus thoracicus aorticus. And also we will have few splanchnic nerves that will not supply anything in thoracic cavity, that will travel to abdominal cavity. Some of these branches of these ganglions will unite and create nervus splanchnicus major, like greater splanchnic nerve, that go through diaphragm, enters your abdominal cavity, and enters plexus celiacus. You have left thoracic 10th and 11th, and these branches also can unite from them and create nervus splanchnicus minor, like lesser splanchnic nerve that also go through diaphragm and goes to plexus celiacus. It enters ganglion aortica renalis. And in some cases, if there will be thoracic 12 ganglion, some fibers from thoracic 12 ganglion can create nervus splanchnicus immus, like the lowest splanchnic nerve that also travel to abdominal cavity, but it even do not enter celiac plexus. It goes straight to kidneys, to plexus renalis. In abdominal cavity, you have like continuation sympathetic trunks that consist of ganglia lumbalis, truncosympathic left and right, located on the bodies of your lumbar vertebrae. And then these fibers from these ganglions go to your internal organs and to your spinal nerves. So first of all, you have ramicommunicantes grisae that goes from these ganglions, join your spinal nerves, and these post-ganglionar fibers goes in all branches of your lumbar plexus and supply mostly skin and muscles of your abdominal cavity, pelvic cavity, and parts of lower limb. Then you have nervi splanchnic nerves that come to your internal organs, but most of them not goes directly to internal organs. Most of them, as you can see, goes to your aorta. Then there they unite and create the biggest sympathetic plexus in your body that calls plexus aorticus abdominalis, abdominal aortic plexus. It consists of few plexuses actually, or you can divide it on few plexuses. that are situated around the biggest branches of aorta. And the biggest, and I guess it's the most interesting of them, it's plexus celiacus. As you can see, around your truncus celiacus, you have big plexus celiacus. Celiac plexus that consists of 5 ganglions. So, as you can see, you have 2 paired and 1 unpaired ganglions there. So, first of all, by the sides of truncus celiacus, you have 2 ganglions with the same name. That calls ganglion celiacum, right and left, dexter and sinister. Next, below it, on like where is origin of arteria mesenterica superior, there will be unpaired one ganglion that calls ganglion mesenterico superior, superior mesenteric ganglion. And finally, you have also 2 more ganglions that are located in this place where is origin of kidneys artery, arteria renalis. And they have name ganglion aortica renalis, aortica renal ganglions. So here you have 5 ganglions, they united between themselves, and this is plexus celiacus, celiac plexus. It get these nervus plantans abdominalis from your lumbar ganglions that come here and bring the post-ganglionic fibers. Next, you have from that I told you previously, you have nervus plantnicus major, minor, and imus sometimes that came from your thoracic cavity. But you must know that plexus celiacus get not only sympathetic fibers. On esophagus and gaster, you have 2 truncus vagalis, anterior and posterior, 2 vagus nerve, anterior and posterior, and its fibers, mostly from posterior one, also get inside celiac plexus. But this vagus nerve, it consists parasympathetic and sensory fibers, so they will just go through these ganglions without transmission and will travel with another fibers of celiac plexus to innervate your internal organ. Also, you remember when we speak about cervical plexus and we speak about the longest nerve of cervical plexus, it's nervus phrenicus. And we speak about the right one, here is nervus phrenicus that go through diaphragm, and its fibers reach also celiac plexus. Plexus celiacus get all these fibers go through its ganglions, and then like fibers go out of these ganglions and lay on these vessels and create plexuses on each vessels and supply like corresponding organs. And also these fibers from ganglion aortica renalis create plexus renalis that lay on kidneys artery and supply your kidneys, and also pay attention also glandula suprarenalis, adrenal gland. So medulla get it's the exception. It's one tissue in your body that get pre-ganglionic fiber. So this from lateral horn fiber go through anterior root, then gets to your sympathetic trunk, then will be nervus plantnici that get to celiac plexus, and also go transit and laying on adrenal artery, I guess in most cases on inferior, get inside and supply your medulla without transmission. Next, also from this plexus celiacus, we have fibers that came exactly from ganglion mesenterico superior, superior mesenteric ganglion. And these fibers, as you can see, they lay on arteria mesenterica superior and create plexus mesenterico superior. And these fibers goes with all branches of this artery and supply corresponding parts of your digestive system. Next ganglion is located where is beginning of arteria mesenterica inferior. ganglion mesentericus inferior, and plexus aorticus abdominalis that laying on it, and it have a special name. This plexus, as you can see, is located between two mesenteric arteries, and this part of plexus aorticus calls plexus intermesentericus. Intermesenteric plexus. From this plexus intermesentericus, exactly as you can see, there is beginning of small plexuses that laying on arteries. If in male it's arteria testicularis, in female it's arteria ovarica, so there will be plexus testicularis or plexus avaricus, very important, that goes to your genitalia and supply your genital glands. And we come to ganglion mesentericus inferior. This ganglion is located on aorta, in this place where is a region of arteria mesenterica inferior, and branches from this ganglion laying on this artery and create plexus mesentericus inferior. And these fibers that laying on arteria mesenterica inferior goes with all its branches and supply. As you remember, they supply upper part of your rectum, they supply colon sigmoidum, they supply colon descendens, and this flexura coli sinistra, left colic flexion, and part of colon transversum. And this plexus aorticus abdominalis goes down, and there will be like the end of this plexus. On the level of bifurcation of aorta, it terminates. Some fibers, as you can see, they laying on branches of aorta, on arteria iliaca communis dextra sinistra, create plexus iliacus communis at first, then internus, externus, and if you talk about internus, they will supply this fiber, supply all your vessels of pelvic cavity. If you talk about plexus iliacus externus, go with it artery and supply all arteries and veins, all vessels of your lower limb. But the most part of abdominal aortic plexus goes down until promontorium and transforms into new plexus that calls plexus hypogastricus superior. Superior hypogastric plexus laying on promontorium also get fibers from your nervus planthnite lumbalis, from your lumbar ganglions. Plexus hypogastricus superior gives no branches, and then goes down, and on the level of promontorium, it divides, as you can see, on two nerves, left and right. They have name just nervus hypogastricus, dexter and sinister, left and right hypogastric nerves that goes to the sides, reach your rectum. When it reach rectum, it became plexus hypogastricus inferior, big inferior hypogastric plexus. That's left and right located on the sides of your rectum. It gets branches from your sacral ganglions of truncus sympathicus. These nervi splanchnice sacralis. Splanchnic sacral nerves, plexus hypogastricus inferior, also get fibers from your sacral plexus that are parasympathetic, and they called nervi splanchnice pelvice. Splanchnic pelvic nerves that are parasympathetic, and from these places they will go to the sides. They will go to the sides, and they will supply all your internal organs of your pelvic cavity, but not only. They go and supply your upper part of rectum, they supply your sigmoid colon, they supply your colon descendens, and they supply your flexura coli sinistra, left colon flexure. This is parasympathetic fibers. And finally, effects of sympathetic system, again, it's opposite to parasympathetic. So, if you talk about pupil, it will widen pupilla, mydriasis. If you talk about salivatory glands, it will decrease salivation, and so do tears. If you talk about heart, sympathetic system, increase blood pressure and increase heart beat rate. Next, if you talk about smooth muscles of your internal organs, sympathetic system will relax them. So it will decrease peristaltics of your intestines. And so do if we talk about mucose. It will decrease production of mucous glands. Also, sympathetic system, you may remember, supply these musculus arrector pili, small muscle that straighten your hairs. So I thank you for attention. Ask me some questions, subscribe to my channel, and see you later. Peace.